Welcome to our webinar on program evaluation, uses for program monitoring, improvement, and organizational sustainability. My name is Steven Fernandez, and I am a capacity building and evaluation coordinator here at the Latino Commission on AIDS. Our capacity building program is Hands United, as you can see the logo in the lower left-hand corner. So our agenda for today's webinar, we're going to give you a quick introduction to the Latino Commission on AIDS. Then we're going to go through some objectives and goals of the webinar. We're going to overview different concepts and really try and answer, what evaluation can do for you and your work at your agency. And then just some simple discussion to wrap up the webinar. So an overview of our organization, the Latino Commission on AIDS. We were founded in 1990 to fight HIV and AIDS in at-risk communities nationwide. Our organization does work a lot with the Latino population throughout 40 states, Puerto Rico, and the Virgin Islands. We have a long history of building national, regional, and local coalitions, and our organization is the founder of the Hispanic Health Network. 5 of our core areas as an organization are research and evaluation, HIV prevention and health promotion, capacity building assistance, which is the division where I work, HIV testing and access to care, as well as health policy and community mobilization for various issues. And our capacity building assistance program, our 3 main content areas are high impact testing, prevention with positives, and organizational management. High impact testing, we cover topics such as stigma mapping, targeted testing, recruitment and retention. Other CBA services that we provide include cultural humility, addressing stigma, understanding and managing burnout, strategic planning and board development. We offer these services to CBOs around the country in both English and Spanish. And as a program, Hands United's values are sex positivity, multiculturalism, innovation, critical thinking, and health equity. Okay. So, what we hope to accomplish today. Our objectives are to provide definitions of program evaluation, which are process, outcome, and impact are the types of evaluation that we're going to be looking at today. And we're also going to discuss the applicability of evaluation methods for monitoring, improvement, and sustainability of programs. Our goals are to understand the components of program evaluation and identify the utility of evaluation activities and effective program and organization's mission. Essentially just to say what are some outcomes we can expect from really improving and engaging with our evaluation activities as a program. Sorry, we're having some difficulties advancing the slides. It's a little bit of a lag. Okay. So with program evaluation, 2 main definitions there, right? So evaluation is the use of social research methods to systematically investigate a program's effectiveness. And when we're talking about programs in program evaluation, it can be an organization, a program within an organization, a project, an event, whatever the object of the actual evaluation is, right? It doesn't necessarily have to be a full-fledged program. Can anyone tell me what the difference between research and evaluation is? I'll give you a few seconds. Okay, well, evaluation is a form of research, but not all research is a form of evaluation, right? Not all research is evaluating the effectiveness of a program, but evaluation is doing research into a program, right, and whether or not it's being effective. So what are data? Data is any information that is systematically collected about the program that helps to understand what the program has achieved and whom it has reached. Data can be available from sources outside of your particular program or agency at the local, state, or national levels, and it can be used to inform your program's agency's funding efforts, right? So it can be any of the different types of data that we mention here on the screen. So meeting notes, case records, attendance sheets, workshop satisfaction surveys, pre-post tests, interview notes, field observation notes, client information databases, referral tracking logs, and risk assessment forms. This isn't an exhaustive list. Data can take on many different forms depending on what we're trying to achieve and what information we're trying to capture. And some great resources for finding data that's publicly available are the CDC here in New York. The New York State Department of Health and the New York City Department of Health are great resources. Different departments of health throughout the country make their data available in different ways. Some are more advanced than others. And also different NGOs and different researchers can offer data into really specific subpopulations that may not be captured by bigger data sets. Okay, so why is evaluation important? So I'm going to read a quote to you that we have in our notes here. There's a misconception that programs and evaluation are separate. Evaluation is another term for good management of a program. So what we're really trying to get at here is that evaluation's a major tenet of a successful program. It's important to make sure you're evaluating your progress and your impacts, as we're going to discuss throughout the webinar, in order to make sure that you're achieving your goals and to be able to show your funders and potential future funders about the work you're doing and how successful you've been. Okay, so why is evaluation important? You can make mid-course adjustments to improve your program. You can make strategic decisions about the future of your program, whether you think it would be viable to reapply for another grant cycle, for example, or maybe that can affect staffing decisions about the future of your program, helping design future programs and assess prior programs, contribute to your agency's or program's sustainability plan, and justify future funding to decision makers through potential grants, right? Evaluation is important for all of these reasons, and I wouldn't say that there's one that's more important than another, especially when we're talking about helping to design future programs and contributing to your agency's sustainability plan. Evaluation is really what's going to back up any of your claims as far as being able to implement a program again or being able to sustain it for any given period of time. Okay, so some more points on why evaluation is important. It helps promote demand for your services to stakeholders. It shares experiences with others working in similar areas, provides an evidence base for other service providers who may wish to replicate your intervention, and from a social justice standpoint, it helps find out who the most vulnerable populations are receiving appropriate and effective services. So just to break down some things on this particular slide, really important is providing an evidence base for other service providers who may wish to replicate your intervention, especially when we're talking about more limited target populations. Evaluation is really important, and it's important to have this data available because other groups working with similar populations, whether it's in your same state, city, or might not even be the same country, they can look at your work and see how it was effective, in what ways it was effective, and what are some opportunities to adapt the intervention to be successful elsewhere. And then from a social justice perspective, right, If we're trying to find out if the most vulnerable populations are receiving appropriate and effective services, especially in the field of HIV, we really want to evaluate how our clients are not only navigating our system, but what's the impact of our interactions with them, right? So did they feel comfortable? Do they come back? Are they retained in care? All of these things contribute to your evaluation activities. Okay, so just some barriers to some benefits to evaluation, right? It helps with decision making and program planning. It reaffirms that we are on the right track. When we talk about how evaluation is such an important component of programs, we always want to make sure we're on the right track, right? You don't want to get to the very last year of your grant cycle and realize that you weren't actually monitoring the right indicators, or you didn't do them periodically, so you're not meeting your goals and your deliverables, right? Evaluation can help improve programs and service delivery. It can help you fulfill grant or contract requirements. As we all know, our grants come with very specific and well-outlined outcomes that are expected after receiving funding. So evaluation helps us keep on track again, right? And it helps determine the cost effectiveness of programs. It could give us an idea of how easy it would be to replicate a program, especially when we're talking about cost effectiveness. A program may be effective, but even though you might be achieving the desired outcomes, the cost may make it too expensive for your agency to continue or for other agencies to adopt. So evaluation activities really help us decide what the cost effectiveness of the program was. Does anybody have any other ideas for what a benefit of evaluation activities could be? Okay, so we're just going to keep going right along. So some barriers to evaluation, right? Lack of resources and lack of skills and staff time. So some evaluation activities, especially when we're getting into statistical analysis, require access to certain programs. Some organizations just use Excel. Others use a little more advanced forms of statistical analysis, such as SPSS and SAS. And the skills, to use those programs or to know how to collect and enter data appropriately may not be well distributed at an agency, or there may not be individuals that have these skills, right, or the time to really sit down and enter all this information, make sure it's stored appropriately, and then have it analyzed. There may not be, or there may be a lack of management support, a lack of useful or relevant data, or funder guidance. There might not be clear instructions on how to collect data on certain indicators, though the funder may expect you to collect data on that indicator, and fear of consequences, which is a lot more common than you would think, where individuals feel that a negative evaluation might be an end-all for their program, but in reality, the evaluation is just supposed to show you where your opportunities to course correct and to fix what you're doing. It's not supposed to be a death sentence for you or your program. So some vocabulary that we're going to go through today. On the following slides, we have process evaluation, impact evaluation, formative assessment, process monitoring, and outcome monitoring. These 5 terms are very important to our understanding of evaluation activities. So just to go through them, we are going to start with differentiating between monitoring and evaluation, right? Monitoring is the organized process of overseeing and checking the activities undertaken in a project to ascertain whether it is capable of achieving the planned results or not. So we're checking in throughout the program and seeing what exactly it is that we're achieving, right? What are our inputs and what are our outputs? And when we're talking about evaluation, again, it is a scientific process that gauges the success of of components of a project or program and meeting its goals and objectives. So when we're looking at evaluation, we're trying to take the information that we got from monitoring activities and then comparing it to what we wanted to do at the beginning of the project, right? So now, moving on to the terms that you see here on the slide. Process evaluation determines whether program activities have been implemented as intended. Usually, process evaluation occurs during a program or intervention because it helps give you early warnings to issues and implementation that you might be having. Outcome evaluations measure the degree to which the program is having an effect on the target population. As you'll see, when we're talking about outcome evaluations, we usually look at two groups, one that is undergoing the intervention and a control group. We also have impact evaluations, which usually occur during and after an intervention or program, and it's the degree to which the ultimate goals have been met by the program, right? Now, for formative assessments, it's during the development of your program, and that's usually trying to see whether the proposed program elements are likely to be needed, understood, and accepted by the program population. And that is to maximize the chance of success of the program before you implement it. So it's trying to make sure that whatever you're doing is responsive to the needs of the population and whether or not they will accept it. Okay. So coming back to formative assessments, right? It collects data describing the needs of the population and the factors that put them at risk. You do this sort of work when you do an intake with a client, for example, and do a risk assessment, take a history to see what they may need or have strengths in, or screen for eligibility. In this context, we're looking at your community like it is the client. Some questions that this type of assessment may answer for you, right? How should the intervention be designed or modified to address this population's needs? What we can learn from pre-testing our approach, and are the materials we are going to use appropriate? So when you're doing a formative assessment, your results help you learn what the community needs and wants as opposed to just trying to guess. And this will help improve the cost effectiveness of your program. Okay, and does your organization have the ability to perform key functions? So when we're talking about assessments, right, it's not just what our community needs and wants, it's what are we able to provide as an organization. If an intervention is video-based, do we have a projector or a television, for example, and a space and the clientele that would attend in order to ensure a successful intervention? We question our organizational and capacity assessments, We question our ability to provide the services to the clients from an organizational perspective, and it helps us see how successful our program is going to be in the future. Okay, so now moving on to process monitoring and evaluation. For process monitoring, we're collecting data that describes the characteristics of the population served, the services provided, and the resources used to deliver those services. Process monitoring answers what services were delivered, what population was served, and what resources were used. And when we're talking about process evaluation, it collects more detailed data about how the intervention was delivered, differences between the intended population and the population served, and access to the intervention. So as you can see, the two process monitoring and process evaluation are a little different because we want to see what the differences are, right, between what we expected and what was the actual outcome. So when we're looking at process monitoring versus process evaluation, right? So the blue bars that you see here are the targets, right? Let's consider each category its own indicator. So each blue bar is the target, and each red bar is what the agency actually achieved. So as you can see, for most of the indicators, right, the targets were much higher than what was actually accomplished, except for when we look at category 2, right? We see the red bar, so the what was actually accomplished is much higher than the blue bar, which was their target, which may show the organization that they've made exceptional progress with this indicator in particular, while they have also maybe fallen behind with other indicators. So it shows them that they had to work in the indicators for category 1, 3, and 4, but maybe category 2 doesn't need as much emphasis moving forward. Okay, now moving on to impacts and outcomes. So outcome monitoring. It collects data about client outcomes before and after the intervention, such as knowledge, attitude, skills, behaviors, or intentions for behavior change. And this type of monitoring answers, did the expected changes or benefits occur? Now, we're not trying to measure, whether the program is affecting all individuals the same way. We just want to see on an individual level how it's really affecting your clients. And then when we're talking about outcome evaluations, it collects data about outcomes before and after the intervention for clients, as well as with a similar group that did not participate in the intervention before. If you remember earlier, I did say that when we're talking about outcome evaluations, we're looking at a group that undergoes the intervention as well as a control group. For those of you unfamiliar with the term control group, it is usually used in research and evaluation. So it's a group that is usually similar in characteristics to your group that is undergoing the intervention, except they do not receive the intervention. So it's to see what the progress is within both groups and to be able to accurately compare your results. Okay, so this slide really breaks down outcome evaluation versus outcome monitoring for you. Starting with outcome evaluation, we can see there's an intervention group and a control group. And the intervention group goes through the intervention, the control group does not. And we can see that at pre, the intervention group tested at 55% and at the end at 85%. And in the control group, they started at 52% and finished at 80%. To the right, we see the differences in the pre-post tests, and we can see that there was a higher effect in the intervention group, right? Now, we don't want to assume causation here. We're not saying that the intervention will cause, X, Y, Z, because we're not sure, because there can always be other factors at play. And moving on to outcome monitoring, again, we're just looking whether the individuals undergoing the intervention, how are they starting out, and how are they finishing, and whether our outcomes are those that we're intending. Okay, now, this slide is entitled Devil in the Details, as you can see by the skull to the right of the screen. Now, when we're talking about impacts, it's a strong case that the intervention is the sole reason for the outcome. This is a pretty bold statement because, there's so many factors that affect our programming, right, that it's very difficult to pinpoint what exactly is responsible for a behavior change. Now, all impacts are outcomes, so there's some strategies for making the cases for impacts. For example, pre and post data and follow-up data that show, behavior change or maybe differences in testing. If you're, going through any sort of blood-based testing, for example, standardized measurements and standardized data collection help us prove impact, because if individuals are they're having their data collected in a standardized way, it can be compared across populations and groups. And then just understanding of their evaluation questions in a logic model always helps. Logic models can be a pain to develop for different programs and where you're making a grant, but when we're talking about evaluation, it can really help pinpoint where some issues in implementation you're having, or where it helps you see where you're devoting your resources and where you can devote more resources to. So this goal may seem scary, and at times looking at a lot of numbers and the thought of impact evaluation may seem frightening or daunting. If you look closely at the skull, there's an upside-down heart where the nose should be. Sometimes taking a moment to really look at the data without fear can lead to wonderful things. And that's just a little side note from our Director of Evaluation here at the Commission. Okay, so now looking at impact evaluations, it collects data about HIV and STI infection levels at the jurisdictional, regional, and national levels. And it really answers what long-term effects do interventions have on HIV infection, right? So it's trying to see whether our programs, whether they're individual-based or more systematic and larger in nature, what kind of effect they're having on the overall rates of HIV infection and treatment in our country. Okay, so here, coming back to the idea of using your logic model throughout your evaluation activities. So planning, implementation, outcomes, and here under each box we see which form of evaluation we would be using throughout that step. So in the planning stage, formative assessments. In the implementation stage, process monitoring and process evaluation. And in the outcome stage, outcome monitoring, outcome evaluation, and impact evaluation. So, can anyone think of some implications of not knowing how an intervention was implemented if you're trying to evaluate it? All right. So if we don't know how an intervention or program is being implemented, it makes it really difficult to evaluate, because we know what the starting framework was and we know what the final outcomes are, but that information may not always link up very well, and it's important to be able to look at the different aspects of implementation, because they have different considerations when you're implementing, right? So, this is a kind of basic framework for program evaluation, and I'm just going to go through the whole circle, and then we can chat about where we should be beginning, right? So I'm going to start at the very top, so engaging stakeholders, then describing the program, focusing the evaluation design, gathering credible evidence, justifying conclusions, and using and sharing lessons learned. These are all pretty basic tenets. You'll see them used by evaluation scientists in general. And we have a question from Eric Nieves. Will participants receive a copy of the slide presentation? Yes, we can send you a PDF copy of the slides at the end of the presentation, and I'll go over that at the very end. Thanks for the question. So when we're talking about developing our evaluation, some things to consider. Who is more likely to need and use the information obtained? So are we developing this evaluation for a funder, for the staff to be able to see how they've been doing over the past year, for the agency management? These things may have different indicators that you may want to present depending on who is going to be accessing the information. What is the primary purpose of the evaluation? Again, are we just checking in at a regular interval to see how our process is coming along? Or are we trying to do kind of an end of cycle all together summary of our program? How will the information be used is really important, and where do I begin using this framework? So we want to make sure that that we kind of keep this framework in mind when we're developing our evaluation plan. You can start at different points depending on what your past experience with evaluation is, and maybe how developed the skills are at your agency to be able to engage in the evaluation process. So it's really a matter of seeing where in the cycle that you fall and where you think you need to begin your work. So some internal uses of evaluation findings helps provide direction for staff. It helps identify staff and volunteer training and technical assistance needs, which is where programs like ours come in for directly funded and non-directly funded CBOs. We help point out program improvement needs and effective strategies, support annual and long-range planning, guide budgets, and justify resource allocations. Again, this is really important when we're talking about implementation, about justifying where our resources are going and when and how we need to move those resources around depending on how our monitoring and evaluation is coming along. Some other internal uses for findings would be to suggest outcome targets and help focus board members' attention on programmatic issues. Okay. And some more internal uses for findings. Findings demonstrate programs' value and role in your community's human service network, and we can use them to recruit talented staff and volunteers, promote your program to potential participants and referral sources that may be identified through evaluation, identify partners for collaborations, enhance your program's public image through, really being proud and showcasing your accomplishments and progress through your indicators, and retain and increase funding when you can show that you are meeting the needs of your target population and really excelling as far as the goals of your program. Now, some tips for a successful evaluation, right? First and foremost, please develop an evaluation plan. It is next to impossible to reach the end of a program or a grant cycle and then try and develop an evaluation plan. One, it should be included most likely in your grant. And two, you can't, go back in time and find all this information, or, at the end of the grant, you don't want to be in a position where, this report would have been stronger if we would have captured X, Y, Z. So that's why we want to be revisiting the evaluation through, our monitoring activities throughout the lifespan of the program. Some more tips. We want to integrate evaluation into ongoing activities of the program. So any information that may be vital, no matter, how kind of benign it may seem, just making sure that it's being stored and collected somewhere in a systemized way for future use. We also want to actively participate in the evaluation. We want the staff at your agency to understand the purpose of the evaluation activities and understand how their role, possibly as frontline staff who are probably collecting a lot of this data, how important it is to make sure that they're collecting and entering the data appropriately. We want to get all the staff involved, and we want to be realistic about the burden that evaluation activities put on the staff, especially when it comes to data entering and analysis. It's not necessarily that these processes are very difficult, they're just time-consuming, especially if you're working, with Excel or SPSS, where you're entering data kind of one data point at a time for, countless individuals. So just being cognizant of, the burden that that's going to put on employees at your agency or at your program. And programs like ours, the Hands United CBA team, can assist with developing an action plan, an evaluation plan, and helping work with different programs and agencies to really look at their evaluation plan and see how we can strengthen it, and to see how the evaluation plan links up with the expected indicators and outcomes for a program. So thank you so much for sitting with me today in this webinar. Does anyone have any final comments or questions before we wrap up today? Okay, so I do see, what are some examples of formative assessments? So, a formative assessment can take very different phases. For example, it could just be community mapping, where an agency kind of goes into their community to see where individuals are hanging out, what they're doing, where they're accessing services. Formative assessments can be just looking at the data for a community and compiling that information. For example, some socio-demographic information, such as, what are the rates of education, of poverty, of housing in our community. So a formative assessment can really be generated by a lot of different sources of data, and they can take on a lot of different faces. Any other questions? Okay, I think we have one coming in. Okay. Do you need to start at the top of that cycle? So I believe that is referring to the evaluation framework. No, you do not always necessarily start at this point in the cycle, right, and engaging stakeholders. You might actually start from using and sharing lessons learned, depending on how recent your last evaluations were. You might really start there and say, okay, last time we realized that this was an issue and that was an issue. How do we address these before we start the process over? So that's not an uncommon experience, and a lot of you may experience that yourselves going forward. But there's not, I wouldn't say that there's a particular point in the cycle where you need to start, as long as you move through the whole cycle and address the different issues. Okay. So, if we don't have any more questions, just if you're interested in requesting capacity building assistance services from us at the Latino Commission on AIDS, you can request it through the CRIS system if you're directly funded by the CDC. And if you're not directly funded, you can contact your local or state health department, which should be able to submit requests on your behalf for capacity building. Any form of CBA from the CDC, so programs like ours, are completely free to you at your agency. Our travel and housing and everything is covered by us. And we love working with different community-based organizations around the country. And yeah, so I just want to again thank all of you for joining us this afternoon on our webinar on program evaluation, and we look forward to working with you in the future. Please look out for an email from me with a registration link. We did not send it out prior to starting the webinar. So if you could please just send us, just take the 2 minutes to fill out the registration link, and we will send you the PDF of the slides that you used today. So yeah, thank you everyone, and have a nice rest of your week.